participation that the community has in terms of creating and furthering this outreach. We have more details to put out once we crunch the numbers even more, to highlight and show those test positivities by different groups, to demonstrate and confirm that we are moving in the right direction, even though we still have a lot of work to do.
We have not yet cloned Dr. Gayles, and he's got to bounce at about 1 o'clock to be on another panel. So reporters, if you have a question specifically for Dr. Gayles, please enter that into the chat, and we'll get to those questions first. Dr. Stoddard, did you want to kick off with any remarks before we go to questions?
Yeah, I'm just going to give a couple quick updates. We're expanding our personal protective equipment. Our Department of General Services and Procurement have made we've actually made a purchase of almost $15 million of PPE over the last month to continue our efforts to make sure that we're ready for the fall, spring, and beyond for personal protective equipment. We did do a child care distribution on Saturday. More than 600 child care providers received personal protective equipment, cleaning supplies, infrared thermometers, so they continue to operate for the next 4 weeks. We gave them a 4-week supply. Dr. Gayles and I did a walkthrough with the Montgomery County Public Schools. Deputy Superintendent McKnight was there, as well as other members of the MCPS staff to walk through an in-school experience last Thursday. I think the obvious comments are that while we all agree that having in-school education is an important part of childhood development, we are not going to operate schools unless they're safe for both faculty, staff, and students. That's been clear. I know that Prince George's County announced they're keeping all online through the fall, and so we're going to be continuing to evaluate those circumstances with our partners in MCPS, and we'll make similar determinations as conditions warrant. Education enforcement. County Executive alluded to the letter from the governor. We're already doing the work of enforcement. I know we made announcements related to the closure of a few restaurants restaurants operating sort of like bars over late at night, over the weekends. Our clear message is the overwhelming majority of businesses are doing exactly what we've asked them to do. In other cases, we've attempted to use education to get those who are close and making a good effort to be fully in compliance. And we only turn to enforcement in the limited circumstances where there's been a willful ignorance or willful ignoring of the public health guidance to really pack people into places that they shouldn't be in without face coverings and other things like that. So, and then finally, last night we had our Community Recovery Advisory Group kickoff meeting. We had 49 representatives from county residents across the county. Some really great discussion about what our work in recovery will entail and the challenges of doing recovery in the context of an ongoing response. All things that we're aware of, but certainly their perspective on how we can do things better is very important to us. We'll meet again on July 28th, and we'll continue to be with that group moving forward to give us a good perspective from a diverse representation across the county.
Thank you, Dr. Stoddard. We will kick it off with Caitlin from Bethesda Beat, who has a question for Dr. Gayles, because as I mentioned, he has to go in about 15 minutes. So for the reporters, questions for Dr. Gayles, please put those into the chat. Go ahead, Caitlin.
Hi, Dr. Gayles. Yesterday at the Montgomery County Board of Ed meeting, you said that the county needs to make some more serious improvements in COVID-19 conditions before buildings could reopen. But I wasn't clear about your answer to a board member's question asking whether the county needs to move forward to the next phase, as we're calling it, for that to happen. Can you address that? And additionally, can you just explain if there are any specific metrics that you're hoping to see improvements in, just to give a clearer picture of where we need to go from here to get to that point?
Good afternoon, and thank you for your question. So the reason why I didn't necessarily say a phase is, again, making sure that we're consistent with the state and moving together. But what is clear that in order to be able to move forward, as Dr. Stoddard just mentioned, is that we are at a place where we have seen significant improvements in the load of the virus within our community. We're seeing less community transmission, and we are at a point where, because the reality is when we reopen things more and we increase contact points, whether we're talking about kids or adults, we want to make sure that we've driven the burden of the virus down to a much smaller number that alleviates or has a low probability or risk of it being transmitted from person to person within our communities. So the types of things that we're looking for is basically, again, what we would look for in terms of moving forward in our phases, a place where we are seeing minimal cases and minimal evidence of large-scale, widespread community transmission. We're seeing significant, even increased access to testing to be able to test quickly for anyone who is identified as a contact. And we're moving in all of those right directions. Right now, when we look at our daily case average, we've improved from 300 to 150 to now we're hanging out in the 50 and 60s, but we've plateaued a little bit. And so we've got some more work to do to drive that number down even more, so that we feel that we can safely open up those schools again. And some of the other things that we can't necessarily control that would be very helpful in that conversation is, if we do have a vaccine or we do have some other types of scientific advances that would, again, alleviate some of the probability and the higher risk of transmission if we were to open those types of venues back up.
Okay, Caitlin, Dr. Gayles, thank you very much. Up next is Randy Bass with WDVM with a question about testing.
Good afternoon, everybody. Thanks for having me on the call. Question for Dr. Gayles. I've noticed that when you're looking for a testing site in some of the more outlying areas of the county, say Damascus, Laytonsville, Poolsville, sometimes that nearest testing site is a 20-minute plus drive or somewhere outside of the county entirely. Can you touch on how the county might expand testing in the western and northern areas of the county?
Sure, that's an excellent question. So I want to emphasize that a point that I think it's important to remember. So testing can happen in places outside of the sites that we put forward as a county. You can get tested at your primary care provider, urgent care facilities, and a host of other places. Now, we do recognize that for many locations, that still does present a travel obstacle. There still may be some distance within that. So we are working with some of those municipalities to set up pop-up testing events and exploring other options to be able to provide testing. For example, I believe there is a pop-up testing site that's going to be in Poolsville on, I think, July 18th. Let me check on my notes and confirm, but we do have one scheduled for Poolsville. And as I mentioned, we're also working with other municipalities, particularly in areas that, as you described, have a farther distance between those test sites and access to that to make sure that they're more accessible.
Thank you, Dr. Gayles. Tom Fitzgerald with Fox 5 is up next with a question for the county exec. Hold on, Tom, 1 second. Let's get you unmuted. There you go.
There we go. Thanks for doing the briefing, as always. County Executive, you alluded to it earlier. But I'm going to give you two right off the bat so we don't have to jump back and forth. The governor's letter yesterday raised some eyebrows with some folks because at one point he alluded to and wrote, you have a responsibility to enforce the laws. County Executive, are you enforcing the laws?
We're trying to. We're going out with our ambassadors. They're inspecting business sites. They're giving them guidance. We know this is new for everybody, so we figure everybody gets a one-time, okay, these are the things you need to fix. We'll be back. We want to see them fixed. But we've closed businesses down, and other businesses have just chosen to comply. And then one owner decided he wasn't going to open at all on his own, which I don't know why anybody would walk away from money over whether or not you wear a mask, but that's his decision, not mine. So we're enforcing, and we're going to do the same thing on the construction sites. I mean, these high-risk jobs tend to be the ones that are least monitored, and we're going to go in and monitor them and get these folks to comply as well. This is the only way we're going to get this done.
And just
but the governor has an enforcement authority. He does have the state police. I mean, I'm a little bit surprised that it's not a joint effort, since he has resources he can put into enforcement rather than saying, this is the state rule, and by the way, everybody go enforce it for me.
And just to follow up on that, we talked to the general manager yesterday of Tommy Joe's in Bethesda, and they've invested a lot in plexiglass shields around the bar. They were sanitizing the restaurant while we were there. They've been doing a lot of work to get whatever business they can. They're very concerned that the few bad apples are going to ruin this for everybody. So what can you say to the bar and restaurant owners about how the county is going to approach this? Is this going to be pinpointed enforcement, or is everybody going to wind up paying the cost for the few people that aren't following the rules?
Right. If I wanted to do pinpoint enforcement, if I wanted to do blanket enforcement, I'd just say, bad mistake, some people are breaking the rules, let's shut it down. We're not doing that. We are relying on the fact that most people would rather be open and would rather do it safely. And I can tell you, customers would rather be in a place that's safe. I've had people who told me about places they would not go into when they saw what was going on inside the door. So we're giving everybody a chance just to come into compliance. The owners do have to have the fortitude to tell somebody who's breaking the law that you have to get out. They have the authority to do that. They don't have to serve people who, violate the law. They should just say, you guys are breaking the law, and get out of here. But we're relying on the fact that I think most businesses in Montgomery County would rather be in business than shut down again. And this is a small price to pay.
Thank you.
Thank you, Tom. Brianna with Bethesda Beat has a question for Dr. Gayles before he has to go at 1 o'clock. And then Jordan will come back to you.
Thank you so much. So I just wanted to clarify something about the benchmarks. I know that you have addressed that there has been an increase in testing. As far as the number of new confirmed cases that's on the data dashboard, I know it's down to 4 declining days out of 14. Are you attributing that pullback and progress to the increase in testing, or do you think there might be an indication of a spread?
That's a great question. So one of the joys of sitting within and looking at lots of surveillance reports on a daily basis is we get data from a number of sources. And the way it's reported is different. So for example, if you look at the way that we report daily totals, we align it with the way the state reports theirs. And that is based upon all of the tests that were resulted positive today, regardless of when they may have entered in the system and been collected. Now, there is another, if you look at, for example, Baltimore City's testing website, they tie that to the REDCap system. And so the REDCap system is another database that we have access to that is kind of behind the scenes, where it reports cases based upon the day it was collected. And so it actually gives a sense of the actual daily case count. Now, conversely, you have DC that looks at it based upon the date of symptom onset. So there's different ways you can present the data. And I say all of that to say that one of the challenges with the way that it's presented by the state is that you can have data dump, so to speak. You could have reporting a lot of cases on one day that weren't necessarily collected at the same time. Now, so we look at everything within context. We look across all of those different things. And when we've looked at our REDCap data, we actually have seen our daily cases hanging out in when I keep throwing out the 50 to 70 range. That's more of an accurate depiction in terms of daily case count. So, for example, when I'm looking at my notes here, when I look at cases from July 5th, 38 cases. So it's reported differently, by the state data in terms of how many labs were resulted that day, but of actual tests drawn in Montgomery County for Montgomery County residents on July 5th, 38 of those tested positive. And so it's when we're looking at the data, that's why I mentioned that we've plateaued, because the numbers are consistently in that range. And it suggests that, some days there's an uptick, other days there's a little bit of a decrease, which suggests that, again, we have plateaued and we're hanging out in that space. Now, I will caution that we have seen an uptick in cases in other areas in Maryland, as evidence when you look at the state totals that are reported each day. And of note, the percentage of those cases has shifted from originally, and pretty much through the pandemic, the majority of those cases each day were coming from the National Capital Region. Data over the last couple of days suggests, however, that the majority of cases now are concentrated in the Baltimore metropolitan area and those counties and surrounding areas. So I think that's another thing of importance. Now, don't get me wrong. We watch these carefully like a hawk every day, and we're looking at different data sources, again, to get an accurate depiction of where we stand to determine if we need to, move forward or move back, and what additional steps we need to take to keep the residents of our county safe.
Dr. Gayles, do you have time for a school reopening question, or do you need to go because it's warm?
Sure. I'll take it. That's fine. Thank you all for your patience, and thank you, Marc and Earl, for allowing me to answer and stuff on. So.
To dominate. Chris Gordon, go ahead real quick.
You're on mute. You're on mute.
Can we get Chris?
You're still on mute.
No. Okay.
There we go.
Now.
We can hear you now.
Go ahead.
I will be brief. We just heard from Dr. Jack Smith, and he's basically saying that they're going to start with virtual learning and hopefully in 8 weeks or so, somewhere around November, move into schools. You just acknowledged, I believe the county executive acknowledged that you've heard that Prince George's County just decided today and announced that they're going to stay closed with virtual learning through January. Is there any chance that Montgomery County will stay closed with virtual learning through January? How would you make the decision to open?
Well, first and foremost, let me say that our colleagues at MCPS have worked tirelessly to review all the data and come up with their plans. They've worked very closely with us and have been great colleagues and very much driven by public health data, and will be continue to do that. I think part of the challenges is we'll have to wait and see how the data goes. Certainly, they recognize that reopening in person is likely not feasible and would hit their virtual plan. And I think they will continue to assess. From my understanding, DC has made a decision to be virtual until December 1st, and will reassess there as well. So I think, it's one of those things we'll continue to see what the data shows and act quickly and decisively to provide that information when it's provided or when it's available. But right now, as Dr. Stoddard mentioned earlier, the data right now does not suggest that in-person instruction is safe to do at this moment. And again, as I laid out to the earlier question, we need to see improvements in the numbers to, again, see little to no infection in our communities to allow us to be able to feel comfortable opening schools up, and that there's low risk in terms of putting people back into those environments.
Thank you for your time, Dr. Gayles. We'll let you go. And now we'll go back to Jordan Lindsay, who has been waiting patiently with my MC Media. She's got a question for the county executive. Go ahead, Jordan.
Great. Thank you so much for your time. I truly appreciate this media briefing. Similar question as Chris Gordon, but to the county executive. MCPS just announced phases on how they're going to gradually do this virtual until they get to a point maybe students will go in person. But I just wanted to know how the county will respond to that. If you can elaborate a little bit more, County Executive Elrich, in regards to that. And how does that correlate with the county's phase reopenings as well?
So the school system exists in a slightly different world than us. And they're a state agency, and they work with the State Board of Education, and whatever plans they do will be approved by the State Board of Education. And I imagine that health officers can alter a decision like that. That would be interesting at the state level to see the discussion between the school board and the state health officer. I think these things are going to get worked out at that level. And I expect that our health officer will contribute to the conversation in terms of trying to express his concerns about, if it's done and how it's done. But the county doesn't have I don't have any ability, from my position to veto or stop or alter something that the school system is going to do. So that's not something I will do more than opine on, and hope that they take everybody's opinion into consideration. I'm a former teacher. This is a big deal. And I know a lot of teachers are nervous about going back. And we need to have a better sense. I guess we'll know pretty soon what the board is going to land on.
I would also add, if I may, in our recovery framework, the education mission area has been one that we've spent a lot of time working with. I would say MCPS has been more collaborative on the issues around COVID than almost any other issue that I've experienced in my time in Montgomery County. We've shared with them information about our reporting for potential exposures, how we notify or how we close down county buildings if we have an exposure. All those things they've really tried to parallel in a lot of ways to what the county is doing. And so certainly, as the county executive alluded to, the executive branch doesn't have certain authorities to close them down. The state health officer, or the health officer does, in many cases via state law. But they've been more collaborative on this issue than any that I can recall. And obviously, we're working with them very closely. We understand the benefits of in-school education. We also understand the risks posed by doing it. And those two things must be considered, reasonably. And at this point, I don't see a safe mechanism to do in school right now. And so barring an improvement in our numbers, I don't know that we'll see it in the fall.
Okay. On that note, Dr. Stoddard, Mr. County Executive, thank you for your time, and for all the reporters on the line, thanks so much for being here. We will see you next week on Wednesday, as always. Take care. Be safe.
Thank you all for coming and asking questions.